Hello, good evening. I am Dr. Ramesh, specialist in ophthalmology, working at Sabah Noor Medical Center in Sharjah. Today I'll be briefing about some tips how to reduce your eye strain due to these digital screens. The word digital screens, it includes your mobile, iPad, computer, television. Nowadays, if you see our kids, they're totally immersed into this digital media, which is really bringing about a lot of health issues. One of the biggest issues we are facing now is vision related. So the first tip will be, is your child seeing properly? It's very important. We don't know whether your child has got any refractive errors, especially after this pandemic. If you see, most of the kids have become nearsighted. Nearsighted means they are seeing only near things. They are able to see only near things. They are not able to see anything far clearly. This is called myopia. There's another condition called hypermetropia where they're able to see far, but the near objects get blurred. So they put an extra strain in order to focus. There's another condition called astigmatism where both far and near they see it blurred. They're not able to focus properly. So any refractive error is going to cause a lot of eye strain when they are using these digital screens. First, make sure that they are comfortable, they are having a clear vision. So get their eyes checked. This will be my first tip. The second one will be you have to sit in front of the computers because nowadays your digital learning, everything is virtual. So you'll be spending more hours in front of the system. So the only way how to relax your eyes is to give frequent break. Follow the 20-20-20 rule. Every 20 minutes, you're going to see at any object that is 20 feet far for 20 seconds. The idea of doing this is when you're focusing at one particular object, your inner muscles go to a spastic condition. When it goes to a spastic condition, there is a false power that is involved in it. You lead to a stage called as pseudomyopia. This will really blur your image and it will cause a lot. You need an extra effort to strain. So how do you counteract this? Just simple, just focus at any far off object for a few seconds and just get back to your work. You then after once, because most of your classes go on for 40 to 45 minutes, during the break you have a 10-minute break. During this break, what we advise you is don't again shift to your screens. Most of you take your mobile, your iPad, or shift on to television. This break is given to have some relaxation to your eyes. Just come out from your workstation. Come out from your workstation. Just walk around. Go near a window. Look at any far object where your eyes muscles get relaxed. The main idea is to relax your muscles. This 10 minute is very important to relax your muscles. Otherwise, you again come back, sit, and you continue your class. So frequent break is very important in giving relaxation to your eyes. The third tip will be there are few exercises that can relax your eyes. I will demonstrate these exercises, how it has to be done. So what you have to do is basically we have 6 extraocular muscles and 2 intraocular muscles. The extraocular muscles are involved in movement of your eyeballs and the intraocular muscles are responsible for focusing. So we want these muscles to be active. So whenever you are free, you can do these simple exercises. What you can do is, the first exercise is eye movements. So you can keep a target, any target, in front of your eyeball, one arm distance. Keep your head straight and move only the target. Move only the target and, follow the target so that your eyeball is moving. Do not move your head. Keep your head straight and move only the eyeball. Move only the eyeball until the cornea comes till the end. Then stay there for just 1 or 2 seconds. Then again come back to the neutral position. Again go in the opposite direction. Again go in the opposite direction until your black comes till the end. Stay for 1 second. Then again come back to the neutral position. Then go upwards. Then go downwards. Then again come back to the neutral position. You must note that you don't move your head, only your eyeballs is going to move. This is the first exercise. The second exercise, basically it is all strengthening your muscles by movements. The second exercise will be in the form of eye rolling. That is, you can rotate your eyeball clockwise. Go to the end, then rotate your eyeball clockwise. Make one full circle, 2, 3, 4. Then just relax, close your eyes for 1 or 2 seconds. Again open and go in the opposite direction. 1, 2, 3, 4. Again close your eyes. You can make 4 or 5 cycles like this. So again, this is going to bring about movements of your eyeball and relax your muscles. It can also strengthen your muscles. The next will be you have to improve your focusing. So just keep an object in front of your eyeball, 1 arm distance. Look at any far off object for 5 seconds. It should be at least 6 meters. Then focus towards the intermediate object. Then focus at the tip of your nose. Again, shift your focus towards far, intermediate, tip of the nose. Far, intermediate, tip of the nose. In this way, the muscles that are going for spasm can be relieved. The next exercise is bring this target slowly towards your eyeball. Bring it slowly towards your eyeball until it blurs or come close to your eyeball. Try to focus it clearly and again take it back 1 arm distance. Again slowly bring the target slowly towards your eyeball until it blurs, doubles. Try to focus it clearly, then again bring it back slowly. So this is also called as pencil push-ups. This is very important for focusing problems, for convergence insufficiency, for any accommodation problems. You can also make a number 8 type. Rotate your eyes like a number 8, horizontal 8. Just imagine in front of you there is a number 8 horizontally placed and just roll your eyes along that 8. Roll your eyes along that 8. Okay. And the next one is you can just, once you finish this, just rub your hands and gently keep it over your eyeballs. Gently push your eyeballs so that it gives you relaxation. It gives you a very good soothing effect. You can feel the pressure getting relieved inside your eyes. So these simple exercises can be done 5 to 7 minutes or 10 minutes daily, 2 times a day. It will really strengthen your muscles and improve your focusing. Basically, it is eye movements and shift of focus near and far that will help to relieve the muscle spasms that happen because of constantly focusing at one particular distance. So these are small exercises. The next tip will be blink. Normally what happens, we blink. There's a physiological process where we blink around 15 to 20 times a minute. But due to extra concentration when we are using these digital screens, this blink rate reduces. Blink helps us in lubricating our eyeball. It spreads our tears equally over the globe, nourishes our cornea. So what happens when your blink rate reduces, your cornea goes dry. Once it goes dry, the image blurs. Once it's blurred, again you need an extra effort to focus properly. So a very simple technique to blink frequently. Now and then just close your eyes for 1 or 2 seconds, open. Close your eyes for 1 or 2 seconds, open. This will lubricate your cornea well and whatever focusing problem is coming because of dryness can be eliminated. The next will be, are you sitting in a proper position? That's very important. Most of the kids sit very near the screen. They keep the iPad very close. So this is not a good habit. You have to sit at least 20 to 25 inches in front of the screen. Ideally, the screen should be a little 10 to 15 degrees below your eye so that your focus is good and your muscles are not straining enough. So this distance, and then you have to sit comfortably, sit very comfortably. You have to be erect. Don't lie down and see. There will be a lot of glare reflections. So sit in a proper position, maintain the distance. Then the brightness level, the contrast level in your screens, this has an important role to play. Each and every individual can tolerate light in a different way. Some of them may not tolerate too bright light. You may notice once you go to bright light sunlight, you feel like closing your eye because of the pigments that can absorb the light. So just you can go to the settings and see what the brightness level to what level is more comfortable to your eyes. The icons, it should be enough size to have a good view. If you want, you can increase the size of the icons. The black against white background is more better. Then your room illumination. The room illumination, the brightness of your screen should match with the illumination of your room. That's also very important. Then you have, sometimes you can see some reflections coming from the screens. This is because of the bright bulbs, overhead bulbs, or it may be because of some light coming from the windows. Sometimes you may get a lot of reflections. This is called glare. In order to reduce this glare, if it is really giving you a problem, if it is straining your eye, you can go for anti-glare glasses. Those who are already wearing a glass can include an anti-reflective coating that will help you in preventing this type of glare. Then you have this blue light, this visible light. We have different wavelengths. The blue wavelength, what studies have shown, it doesn't damage your eye, like it doesn't cause any retinal damage or any changes in the lens. The only thing what it can do is this blue light, it can alter your circadian rhythm. That's something called a circadian rhythm that is responsible for your sleep awake pattern. So this excessive blue light can alter this rhythm, because of which you can have some sleep disturbances. So that is why we recommend you not to use your screens 1 hour before sleep. Otherwise, you may have some sleep disturbances and you may not be fresh the next day to attend your class, or when you're seeing your screen, you will have difficulties. The last tip will be to reduce your screen hours as much as possible. Already you have 6 hours of online classes. After that, you have so much of homework, project work, so many things. So you can reduce your entertainment purpose, whatever you're using, that hours can be reduced as much as possible. Have more physical activity. Your screens is not a replacement for your physical activity. You need to go out and play at least for 1 hour. That is going to relax your eyes, relax your muscles, your body, gives you good sleep, makes you tired. So digital screens is not a replacement for your physical activity. Have a good physical activity. Get hydrated well, drink a lot of water. We are in this dry climate, sitting under the air conditioners. You don't feel thirsty, you don't drink water, you get dehydrated. Drink plenty of water, it lubricates your eye also well. Then have a good balanced diet. Have a good, the vitamins required for your eye is vitamin A, vitamin C, E, and omega 3. This will keep your eye very healthy. So these previously there were some guidelines how many hours you have to sit and use your screens. Now it is very difficult to follow these guidelines, because after this pandemic, almost everyone is sitting almost 10 hours in front of the screens. It's very difficult. If you see the pre-pandemic level, what were our guidelines? Was it was like this: less than 18 months, no screens at all. 18 months to 2 years, you can give them a live chat or anything, but no screen again. 2 to 4 years, screen hours of 30 minutes to 45 minutes. 5 to 10 years, 1 hour to 1.5 hour with a break. And more than 12 years, it used to be 2 to 3 hours with break. That was the recommended screen hours before the pandemic. But it is very difficult to follow now because of the virtual classes. So all what we can do is how we can judiciously use the screen hours without straining our eyes. Few tips which I have told will be very useful. The most important thing is to give frequent break. That's the most important thing. Frequent break. Eye focusing muscles will help you. Eye movements also will help you. It will bring a good muscle balance and a good diet. I think these tips will help you in reducing your eye strain. Still you are having problems with your digital screens, always visit your ophthalmologist and they will help you out what is to be done. I hope this was very useful. Thank you very much.
Well, thank you, Dr. Ramesh, for that wonderful hands-on. I think you have shown and demonstrated a lot of exercises, and
Yeah,
I'm sure not only students, but even parents. A lot of us work from home. A lot of us are glued to the screen these days. I think those examples, those demonstrations, will definitely help all of us to get into it. We will take few questions from the chat box that we have. The first question we have from one of our students, Siri. She's asking, why are eyes affected due to screen or a mobile or laptop? What is the relation?
Yeah, that's what I told. What happens is you are focusing at a particular distance. What happens when you are continuously focusing at a particular distance, the inner muscles for focusing the ciliary muscle, we have one muscle called ciliary muscle, it goes to a spastic condition. Once it goes to a spastic condition, there is a false power that develops. We call it as pseudomyopia. And this also becomes a stimulus for enlargement of the eye globe. That is why your power starts increasing. It starts, you may be noticing that it starts with a small power. And then gradually every year you come, your power keeps on increasing. If you see the growth of the eyeball, it is there till the age of 20 years. So we can expect power changes till 20 years. This is because of the extra stimulus that happens. If you see the overall size of your globe, it is slightly few microns or millimeters larger than the normal. That is why you have this power. So when you are always nearsighted, focusing at one particular, it becomes an extra stimulus. The pseudo power that develops becomes a true power, and it keeps on increasing.
Okay, well, thank you, doctor. There are few parents who are asking, or the students who are asking, is there any particular eye drop or refresh tear, something that you suggest for the irritation in the eyes?
Yeah, definitely. We have a lot of tear substitutes. First, you try out with frequent blinking. Our natural tears is the best to lubricate our eyes. And still, if it is not working out, you have to visit a doctor before you self-medicate. That will be my advice because we have to make sure that there is no other problem in your eyes. Definitely, you can try with artificial tears. It will help you.
Okay, thank you, doctor. There's one question which is coming. How do we treat watery eyes?
Yeah, watery eyes, there are, see, why your eye become watery is either it could be because of excessive tear production or there may be something blocking the tear drainage. So these two factors, it can be exactly told only when we examine the child or a patient. So what is the stimulus for this excessive tear production? It can be due to multiple. It may be an allergic condition. It may be excessive screen hours. It may be a disease, any disease. So all these conditions will stimulate your tear secretion. So it becomes watery. Sometimes there may be some obstruction in the tear drainage also, where the tears are not able to drain clearly. So this also will lead to a watery eye.
Okay, thank you, doctor. Is there any correlation between headache and eyesight, or I mean, does it impact in any way?
Yeah, definitely. Headache, there are multiple causes of headache, of which eye is one important cause. That's why I started with first rule out any refractive error. Your eyesight should be normal. Only then you can tolerate such long hours of such long screen hours. Otherwise, you are going to keep straining and seeing. So, one of the cause of headache is having a refractive error. That is any power related issues. There can be any some diseases also that can lead to headache. Eye disease is also leading to headache. Multiple cause of headache. One cause can be related to the eye.
Okay, thank you, doctor. Now, there is a specific question coming from Nisha Fazil. Is there any possibility to treat myopia and hypermetropia?
Yeah, definitely. We have treatment options. It goes stage by stage. First, in the initial stages, up to age of 20, it is only of glasses. Okay, once you cross age of 20, where your growth of the eyeball is arrested, power is stable, then we have various laser procedures where we can make your power zero. You can be free of glasses. But till the age of 20, we don't do laser because your power keeps changing because you are still in the growth period. For example, if you are -3 or -4 at the age of 12, we do a laser, we make it zero. You are still in the growth stage. So you will develop again -1. Again, you have to get back to glasses. So, and laser is a one-time procedure. You cannot do it second time. So we wait till the age of 20 until your growth is arrested. There is no change in power, and then you can go ahead with the procedure.
Oh, thank you, doctor. Now, some of them are asking, I know due to the pandemic, everybody is more worried about the immune system, everything. Is there any natural way that they can improve their eyesight or they strengthen their eyes? Natural ways, vegetables, carrots, or any other greens?
Yeah, it's almost everyone knows a good vitamin A rich diet is recommended. Have a carrot daily, green leafy vegetables alternate days, broccoli rich in vitamin A at least weekly twice. Then sweet potatoes weekly once, fish weekly twice, daily one egg including the yellow part. Then daily two different fruits of your choice. Berries are very good for your eye. Then you can include nuts, almonds, walnut, Brazil nut, rich in omega 3. All this will really keep your eye very healthy, improve your quality of vision. It will improve your quality. There's something how you see like a normal television and a HD quality. You want to have a HD quality of vision, have good diet, rich in vitamins. That will help you a lot.
Okay, thank you, doctor. Uh, there's one specific question. What are the symptoms of computer eye strain?
Yeah. Computer eye strain, it can range from headache, eye pain, blurry vision, irritated eyes, watering eyes. So all these can present as a computer eye syndrome. Okay. So you may not have anything. End of the day, daily you have an eye pain. Daily you have a headache. End of the day. It could be because of excessive screen hours.
Okay, thank you, doctor. Would you once again, if you don't mind, highlight the 2020 formula, sir, once again?
Every 20 minutes, look at any object that is 20 feet far for 20 seconds.
Okay, yeah, I think that gives a lot of relief for the eyes also. Uh, there's another specific question. How do we prevent dry eyes? Though you answered the natural, I mean, blinking or the system, but still, do you have any specific suggestions, sir?
Yeah, dry eye is actually there are many causes of dry eye. It could be because of it is not only because of the screens. It could be because of many diseases also. So step by step we have to examine. If you see one drop of our tears, there it has got three components. We have lipid component, we have aqueous component, and mucin component. We see structurally there are three components. Even if one component is deficient, you may have a watery eyes, but still your eye is dry because it is not stable enough to lubricate your eye. So to diagnose a case of dry eye, first we have to rule out any disease. We have a lot of inflammatory diseases because the lacrimal gland which produces this aqueous layer, if it is inflamed, if it is not functioning properly due to some disease condition, then whatever tears that is produced is not going to be stable. It is not going to lubricate your eye. Sometimes you may note that you have conjunctivitis, your eye is red, it keeps watering, but it is dry because those tears what is produced is not stable. So we have to examine and rule out any diseases, inflammatory conditions, and then treat accordingly.
Thank you, doctor. Yes. There is also a misconception. I don't know. I mean, it could even be a myth or it could be reality as such. Many people say that people who use glasses or use a lot of screen time, laptop or mobile, the size of the eye slowly reduces its size. Is that true, sir?
No, no, it is not true. Size of the eye cannot reduce. If you are tall, you cannot become shorter. The same way, the eyeball will remain the same. It
Okay.
can become little more bigger. In case of myopia, it goes little more bigger, but never becomes small.
Oh, that's great. Yes, sir. There are a couple of questions related to can screen protectors or computer glasses help to reduce the strain?
Yeah, to some extent, as I said, it can help you because how it is going to help you because again because of the some reflections. You are sitting in a very bright room, overhead lamp. There is some reflections coming from the screen that induces a glare. So that glare can be reduced with anti-reflection glasses or some protective screens. That is it. It is not must that you have to wear, but it can protect you to some extent.
Okay, doctor. So those who have the glasses, I mean, whether it is plus or minus, what is the frequency of their checkup or how frequently should they change their power, whatever? What do you suggest, doctor?
Yeah, that's a protocol of how we screen the children from birth. That is, if you take the first visit, usually they go to the pediatricians, and pediatricians they see any abnormality. Usually they refer to the ophthalmologist. Otherwise, generally at 1 year, 1 year there should be a visit. Then between 1 and 3, one visit. Then after 3 years, there should be an annual checkup. Before entering the school, there should be an eye checkup to see if there is any vision problems. Suppose if a child is diagnosed with to have some eye related issue, or he needs to wear glass, then the first visit will be after 6 months to see how the child is doing with the glass. Then after that, it will be decided whether the child will come every 6 months or annually based. There are some children who have some squint related issues. When there's a squint, then the follow up should be much more frequently. So it is always, I say, it is very important to check your vision closing each eye, because I do get many children who have something called as amblyopia or lazy eye. That is, a child cannot say that he doesn't know what is a good vision. He doesn't know. He feels that is what he's seeing is good vision. Until you check each eye separately, only then you will come to know what is the level of vision in each eye. I want to stress this point because there is one condition called as lazy eye or amblyopia. For example, I say your right eye is very good, 6/6 vision unaided, no glass or anything. Your left eye you are seeing only 50%. So the child, when he's seeing both the eyes, cannot make out that his left eye is weak, and they never present to the doctor. So what happens if this is not corrected before 9 years? The left eye goes to a condition called as lazy eye, where suppose if the presentation is at the age of 13, they discover that one eye is weak. At that age, it becomes very difficult. We cannot improve the vision. But if the child presents before 9 years, that eye can be improved by giving a proper correction. So it is very important to check your vision closing each eye. Only then you will know what is the level of vision each eye has got.
Very good. Okay. Thank you, doctor. There's a specific question. Can a 5-year-old kid use zero power ARC specs?
Yeah, no issues. It can be used. If your vision is good, it can be used. Anti-reflection coating, it can be used.
Thank you, doctor. Well, I think that's been a fruitful session. We have addressed in general most of the questions altogether. And I think we should thank you for your time and for your expertise on sharing. It's been very practical, actually. We didn't feel it like more like a seminar or a webinar.
I think do a presentation and make it boring. It should be more interactive, and it will be more interesting. That's how it should be, because already kids are bored of seeing presentation. They need something interactive.
Yes. Okay. So there's one last question. I think, how do I know if my eyes are getting blur?
Yeah, it's blurry. You will not. That is, whatever you see may not be sharp. That's what I said. A kid doesn't know what the real vision is. They feel that what they're seeing is the vision. That's how it is. Until it is checked in front of the screen or you visit a doctor, you will not know whether your vision is 100% perfect or not.
Okay, doctor. Yes. So thank you so much, doctor, once again for your wonderful session. We do thank all our viewers, parents, and students who have joined on the live stream. Thank you so much. We will be sharing the recording anyway with all of you, so you can again review it. If need be, please do visit the clinic and meet Dr. Ramesh. Definitely, he'll be more helpful. So thank you so much, doctor. We do thank for your kind heart.
Thank you. Thank you very much. Everybody stay safe. I hope we come out of this pandemic as early as possible, and our kids are able to get back to the schools, get back to the routine physical activities. Really, it is really, they are missing their schools, I believe. Thank you.
Yes. Thank you, everyone. Stay safe, stay healthy, and good night. Thank you.
Thank you. Thank you very much.